Hi, it's Gretchen with Serenity Health Advisors back with how to shop drug plans. So if you have a Medicare account, you of course would log in the top right or right here on the left menu button before we do this, but you could certainly do it just without putting any, without signing in. Sorry, my little notifications are popping up. So I'm just going to click on Find Drug Plans, and you would do the same prompt if you were signed in. If you do have an account, what's nice about that is that you can store your drugs in here. And so every year you just go in and you can update your prescriptions, and then well, I'm going to show you how to shop for those drug plans. So again, save time by logging in, log in. I'm going to just go ahead and put in a zip code because the process is the same as far as shopping goes. Okay, so here's your drug plan. Find plans. If you do qualify for any of these, you should click those. Otherwise, I don't get any help. I do want to see my drug costs. So again, if you already have prescriptions plugged in, you'd be able to see that. I'm just going to put in a few just generic type and maybe one pricey type for you to see. And putting in drugs is really simple. You find your dosage, you find, your frequency, and then you add it to your drug list. And then let's do, there we go. All right. So just a few, just so we have an idea that we've got some prescriptions in there. So I'm going to say done adding drugs there. I can choose pharmacy. So I typically am always just going to shop initially with the mail order pharmacy. That's usually the best pricing for these drug plans. But if you have a pharmacy that you like, then you could, put that one into. All right, top bottom right corner, continue to view plans. Okay, so here's how this works. This is going to sort plans automatically by lowest drug and premium cost. The New Year's plans will not appear in here until October 1st of every year. So if you go in here in June, July, August, what's going to happen is it's going to be this year's 2026 is what the year that we're in. This year's drug plans, not next year. So October 1st is when you would go in to shop for the coming year. People always ask, well, Gretchen, my drug plan is covered all my drugs just fine. Do I really need to shop? Yes, you do, because your drug plan every year can make changes, not just in the price, but in their formulary. And their formulary is just the list of drugs that they cover. So a drug that you're on could go away. It could change copay. It could switch from a copay to a coinsurance. So it's best that you know what the changes are, even with your current drug plan. Okay. So this gives me the lowest drug and premium cost. This goes for a whole year. When you work with me directly and you come on in the middle of a year, I can kind of prorate this. But for annual enrollment, which is what most of you would be utilizing this for, the full year is fine because it's January of the next year through December. So it's sorting those drugs by the cheapest option available, which is $9.60 a month for a monthly premium. It's estimating, oh, that's interesting. So it is giving us for the rest of 2026. Let's just see on the filters. Nope. Okay, so it does sound like maybe it's filtering, and we'll go in and look at that. My apologies, that's a new thing for them. You can see as you go down the different premium prices and then the different totals that they're estimating. So indeed, they've picked out the less expensive drug plan for you. So let's go in and look at that plan details, but it's saying that a mail order pharmacy is actually a little bit more, $771. That's the drug and premium cost. It says for the rest of 2026. And then retail pharmacy, I think I picked Walgreens, right? $767. So let's just go in and look at the plan details so you're comfortable looking at that. So this is the overview, tells us the monthly premium's $9.60, tells us the deductible is $615. Your deductible only applies to tiers 3 through 6. So if you're on a tier 1 or a tier 2 drug, you don't have to pay the deductible first. This is the drug list. It tells you if they're generic or brand names. This tells you that both Walgreens and mail order are a preferred in-network pharmacy. And this tells you what the estimated cost is for each of your drugs and what the total is. So here we go. So it's April 30th today. So May, June, July, August, September, October, November, December. So you are paying for that Ozempic, that's our pricey one. So you are paying the deductible on that one because that's a brand name. You are paying that up front the first month, and then you're not. Then it goes into just a copay. That's the current rate on this particular plan. Now let me just go here. All right, so that just takes this down. Sorry, this is not as a broker what I use. So, and they're always making changes in the off season. I just wondered, oh here, view more drug coverage. Okay, that's what I was looking for. So here is your cost for preferred generic, which is tier 1, generic tier 2, preferred 3, non-4, specialty 5, select tier 6. So it's ranking your metformin at tier 1, lisinopril at tier 1, Ozempic is that tier 6, okay? So that's how you know where those rate and then what the initial coverage is and what the catastrophic is. Remember that in addition to your $9.60 premium for this plan, the cap on what you would spend in a full year on drugs for 2026 is $2,100. So it doesn't include your premium. That's just the drug copay or coinsurance. For 2027, we're hearing $2,200. So that gives you an idea of how to shop for a drug plan. And then if you wanted to enroll in that drug plan, you simply click enroll, and it's going to take you out to the WellCare site and enroll. So they've taken brokers out of the mix on these plans. So that's why I wanted to make this video to hopefully help you walk through that. I'm always available via text for quick questions. If you run into an issue, it's really easy for me in between clients or while I'm on a call to kind of, troubleshoot. So that's another way for me to help you do this. If you're really, really stuck, then schedule a call through my website and we'll do it together. All right. Have a great day.